means smart.
In Better Health Today, do you ever feel numbness or tingling in your hands? Do you sometimes overdo it with the typing or texting? You could be suffering from carpal tunnel syndrome.
Treatments for the problem have gotten a lot better. If you do need surgery, it's no longer something to fear.
We met up with a local doctor and his patient to learn more about life-changing advancements. Leo Perry of Bristol loves to ride his motorcycle, but he knew he was in trouble when he couldn't feel the throttle anymore. Turns out he had carpal tunnel syndrome. So what was your first sign that you had carpal tunnel syndrome?
My hands going to sleep. Like total, the last 3 fingers were completely numb all the time.
He came to Dr. Michael LeGeyt of Starling Physicians, who confirmed it was carpal tunnel syndrome.
So your carpal tunnel goes from this wrist crease to about here in the hand, just past the muscles in the thumb. And there's a big ligament that goes from the thumb side of the hand across to this side of the hand. And that creates the roof of the carpal tunnel. And then underneath that, all the tendons and the nerve to the hand go through that area, and that's the carpal.
When that ligament becomes inflamed, it causes nerve pain in your hands.
You know, a lot of nights not being able to sleep or being woken up from your hands being numb and fingers tingling to the point where they hurt.
Not anymore.
Let's take a look at your hands. You had your carpal tunnels taken care of. How are you making out?
Good now. Everything's good. All strength, grip strength's back.
As a maintenance mechanic for the town of Plainville, Leo needs his strength. But his is a tale of 2 surgeries. 10 years ago, he had the right hand done.
Because the right one took a long time to heal. There was a lot of pain, a lot of stitches.
Fast forward 5 years after that, and medical science has improved a lot. Dr. LeGeyt performed a second surgery on Leo's left hand, and the difference was night and day.
And that was just like 3 little stitches, and there was no pain, and it was totally different. I left with a Band-Aid. That was it.
It's been a big improvement, as you know. Here's a good testimonial to show the difference between the newer endoscopic technique versus the old-fashioned open technique. In the open technique, you have to cut through all the muscles in this area of the hand, whereas in the new endoscopic technique, we introduce a camera from this angle, and from inside the carpal tunnel, we can release the ligament without cutting through all the muscles in the hand. And the recovery is a lot faster. They have a lot less pain.
I shoot archery, and that the bow sits in that hand, and 3 days after the surgery, I was shooting on a lead and with 3 stitches, and it didn't bother me at all.
Wow. So many people put off surgery. Is it going to get better if you don't get the surgery?
It won't get better without surgery or without some kind of treatment. Now, not every patient who has carpal tunnel needs an operation, but they do need some kind of treatment, because without treating your carpal tunnel, you'll end up with permanent nerve damage.
Only 1 in 10 people will need surgery. Others may be able to stop the pain with cortisone shots and physical therapy. Greg Anderson is a physical therapist here.
One of the things that we'll initially do to help start gliding and moving the median nerve is just a simple extending and flexing of the wrist.
Okay, so am I doing this right?
Yep, so first one would just be up and down.
He shows me a couple of other exercises you can do at home to make sure you heal well. There are even videos you can follow along to. Is carpal tunnel syndrome on the rise?
With all of the typing and texting and iPhone use, yes, carpal tunnel is definitely on the rise.
If you do need surgery, don't worry. It's not as bad as you think.
They're what's called a MAC, which is a very light sedative. If you've ever had a colonoscopy or maybe a breast biopsy, it's very similar to that. They call it twilight anesthesia, some people do. And so you just get a small sedative just to kind of make you groggy and a little sleepy. Freeze the hand with some Novocaine and perform the surgery. It takes between 12 and 15 minutes.
That's it?
That's it.
So for people who are living with this pain, what would you say?
I would have it done tomorrow.
Yeah, he really said it was no big deal with these advancements. If you have symptoms, don't delay. You can call Starling Physicians. There are 3 locations, 1 in New Britain, a brand new one in Glastonbury, and a satellite office in Southington.
You can find out more about Dr. LeGeyt and his team at starlingphysicians.com.